Okay, good day all. My name is Mr. Kwesi Brown, and I'll be your guide today. This is the first installment of the orientation virtual package. Um, Today we want to discuss quality, which will be the overall theme of these modules, these individual modules. Um, so first on the agenda, we are going to look at the mission statements and vision statements of the ERHA. Then we're going to take a look at the strategic plan and how the pharmacy fits into that plan. You'll have an idea of how the day-to-day tasks or the goals that we set out, how it fits into the overall strat plan of the ERHA, and by extension, how it fits into the overarching this guidance strategic development plan of the Ministry of Health, as we are stakeholders in that organization as well. Then we're gonna look a little bit at the layout of the hospital, looking at the floor plan, where certain things are, and then lastly we are going to look at at a couple of the quality assurance tools that we would use in the department to regulate and control our quality and ensure that quality assurance is maintained along the way. So let's get right into it. Okay, so this is the strategic plan. We're not going to look at the entire document, but usually this is disseminated to the management teams, the various management teams that would make up the executive arm of the ERHA. So what we're going to do is look at the mission statement and vision statement and go through those. Right. Okay. So the mission of the ERHA. The ERHA is a dynamic organization focused on promoting wellness in collaboration with our communities. We commit to providing value-driven, technologically appropriate quality healthcare services through our highly motivated and developed human resource within the guidelines of national policy. All right, so as we read the statement, we can highlight the word quality, and this word is going to be repeated quite often within this document. So before we break down each and every at least important tidbit, or at least important phrase or word in the overall sentences, we're just going to look at the definitions of quality control. So by definition, quality control can be defined as part of quality management focused on fulfilling quality requirements, while quality assurance relates to how a process is performed or how a product is made. Quality control is more the inspection aspect of quality management. And I'm going to read a definition of quality management. Quality management is the act of overseeing all activities and tasks that must be accomplished to maintain a desired level of excellence. This includes the determination of a quality policy, creating and implementing quality planning and assurance and quality control and quality improvement. Okay, so um, that being said, looking at the definitions that we just read out, as you see, planning is a big part of that, and as I said, this is a eponymously a strategic plan. So, and before action is taken, we must ensure that we plan properly. Um, so getting back into this word quality, right? So you're looking at the students. So it's a dynamic organization. So the word dynamic is important because it implies that the organization or the company would have to change or evolve over time to fit the needs of the contemporary era. Um, so after that, now we look at be a dynamic organization, and the focus or the aim is to promote wellness. So that's another thing we look at in collaboration with our communities. So this implies that we would work together with various groups, various external and internal stakeholders to promote wellness within the community, right? Which would be our clientele. We commit to providing value-driven. So that's also important. Keep this in mind for later. Technologically appropriate quality healthcare services, right? So through our highly motivated and developed human resource, which is also important, and important, but not really for this module within the guidelines of national policy, right? So that goes back to the Ministry of Health being the overarching organization to which we belong to as a stakeholder. Um, so we look at highly motivated and developed human resource. Um, this means that we have to ensure that the employees of the organization are fully trained, or at least have the skill set or skill sets to provide back to quality healthcare services. So going backwards, technologically appropriate and value driven. So the training of the staff to provide quality healthcare, it must be value driven, um, to suit the needs of the specific audience. And we do this in collaboration with our communities, and in looking at what quality assurance and quality control, quality management is, we are not stagnated but dynamic in what we do. All right, so moving on to the vision statement now. Right, so the mission is what we set out to do. The vision is where we would like to be, or where we would want to see ourselves in future. The vision, the ERHA is the pioneer, so take note of these words, and preferred provider of quality, quality health and wellness services. So this is the target of the organization. In Trinidad and Tobago, we influence and set measurable standards. So going back to value driven, again, measurable standards of care through excellence in leadership. So the word leadership, we talk about planning again, and an enabling environment that presents a safe haven for all, right? So looking at this statement also presents a safe haven for all is also important, because we need to have a safe working environment for ourselves as well, being the service providers, as well as for our clientele. But looking at these statements, excellence in leadership, so you have to ensure that the leadership of the ERHA can plan properly, develop proper plans going forward to through setting measurable standards. So we have to set goals and targets that can be measured by empirical tools, by demographic statistics, by etiological tools to look at the evolution of disease, or at least the cause of disease and within the communities, um, to arrive at least as much as possible, to use empirical data to arrive at decisions made with demonstrable results, so that we can again put that back into our quality management plans and be dynamic, right? Going back to this, in case we do need to change our modus operandi. Um, so moving on, I'll just run through the values, and I'll kind of stick on shared ownership, but I'll just go through one by one. So respect for human dignity, which is pretty self-explanatory. Integrity, which is also pretty self-explanatory. act with honesty, respect, and transparency, and will encourage and sustain a high level of trust and reliability in the organization. Um, so I'll come back to shared ownership, commitment to excellence, partnership with the stakeholders, relevant stakeholders, individuals, communities, non-government organizations, non-profits, and other sectors are encouraged. Partnership in this case could also mean other RHAs, um, the Ministry of Health itself, and various arms of that ministry, various other ministries. Um, Universal access, affordability, and equity in services. So that is pretty self-explanatory. Quality care, again, we see the word quality come up. We are conscious that our vision will only be realized if our clients receive the highest possible quality care to which they deserve. And innovation, right? Again, tying back into the mission statement where we spoke about being dynamic. Innovation, right? So we always have to be on the cutting edge, and even in the vision statement about wanting to be at the forefront of, or at least being the pioneers and preferred provider. So that comes back to the innovative aspect. So go back to shared ownership. So shared ownership, what is shared ownership? Providers and clients of the organization have a responsibility in guiding and regulating the quality. Again, the word comes up, efficiency, customer satisfaction, and planning of the authority. So planning comes up again. So shared ownership implies that no matter what you do in the organization, the overall goals of the organization, our goal, or each individual parts. The sum is also commensurate to the individual parts separately, right? So just wanted to touch on that. So these are available on the ERHA website as well, for those who would like to take a look at it. If anybody wants to at least read the plans, or at least the plans would be discussed in at least the overall overarching plans, you can always speak to the pharmacist 3 of the departments, of the various departments, for clarification on anything. So next, what we'd want to do is look a little bit at the pharmacy's strategic plan. I noticed in this document there are a couple of things missing, but I will fill in the blanks as we go along. So this is basically the strategic plan for 2019 to 2024, based on various analytical tools used in developing business models and strategic development. For example, a SWOT analysis, strength, weaknesses, opportunities, threats, also PESTLE analyses, where we look at the political arms, or at least political factors that would affect the organization, economic factors, the social climate of the area, the technological barriers or opportunities, the legal or the legislation that would affect the organizations, and the environmental factors, or at least what we would want to do or look at with respect to the environment. So I'm not going too far into those. Those were used to develop basically 4 core strategies for the organization. So first of all, we have, systems reengineering, which is number 1. The next area or next core strategy, cultural realignment, health promotion, and we have institutional strengthening, right? So I will touch on a few of the points in the strategic plan. I won't go through everything for the sake of time, but again, these are available, and in the daily day-to-day activities in the pharmacy, you would see that a lot of these things are implemented. So let me just jump right into it. So develop an in-house client satisfaction survey. This is one of the things that we would have been doing in 2019 into 2020. However, due to some unforeseen circumstances, we had to basically scrap that project and redo it, or commence again. We would like to at least to get this going again within the department, so that we could, accomplish this in terms of where we want to be. So looking at one of the Ministry of Health's goals or targets, they would want to, by 2024, have a 30% reduction in communicable and non-communicable diseases, which pretty much covers the majority of the bases. We see with statistics available statistics or national statistics, that non-communicable diseases especially are responsible for high morbidity and mortality rates within the population. So this is, by extension, an area of grave concern, or at least of grave importance to the Ministry of Health, and being a direct stakeholder, the ERHA, by extension too. So let me see. Look, I forget tired of saying. So develop an in-house client satisfaction survey. So client satisfaction. So what this would do is look at what barriers are there to administering healthcare. In addition to this, well, we'll touch on the other one later, the customer service training that the staff would have been sent on. There's another tool that, or not another tool, but another way in which they would be looking at the delivery of service to ensure that we can reduce these communicable, or at least the incidence of these communicable and non-communicable diseases. Right. So the client satisfaction tool is one of those. So we look at the tactical intervention, which have been to develop a survey tool to arrive at this conclusion. Well, we'd have the year one activities, which would have been implementation. Year two, well, of the pilot, at least year two would have been the actual survey being more widespread due to the well, at least looking at the success rate of the first pilot. By year three, we could discuss, like, just filling in the gaps for the sake of discussion. By year three, we could look at analysis of this data, which could also be done in year two. Some of the collaborators that we would work with would be public health, would be one of those. They would help us at least with analyzing and collating the statistical data and interpretation of that data. Collaborations as well. We can look at various international literature reviews and surveys. So the outcome would be achieving client satisfaction rates of greater than 90% by 2021. Well, this was scrapped due to COVID, but as I mentioned before, we want to recommence and maintain until 2024. So that was supposed to be one of our goals. Not meeting a goal or target doesn't mean the end. I mean, as much as possible, we want to do this, but going forward, we would try to achieve that within the year period of time that we had initially set out to do. So better qualified support staff to meet needs. In terms of getting there, this is the outcome. So just working backward a little bit. What would we want to do? Upgrade of the pharmacy assistants or technicians to meet the specialized needs of the department. So a few of our technicians would have been sent on inventory management courses because of their grave or their great influence and involvement in that aspect of the department too. Not saying that some pharmacists as well were on that program, and the aim of that exercise was for us to build capacity in that area so that we could develop policies or better inventory management policies, and showing how that ties in with the overall 30% reduction in CNDCs, some of the communicable disease incidents. Think about like this: if we manage our resources properly, especially in these times of economic stress on the economy, we manage our stock well. We ensure that it is used properly. tying it in with the customer satisfaction. We have satisfied customers, so we have greater buy-in to the overall plan. We have patients being more compliant, and by extension, we have a well population, right? Tying back into the mission and vision statements, having a healthy population. So I just wanted to kind of touch on a couple of those, not noted here or not documented here. There's also an initiative which would fall under communicable diseases. There's an initiative to look at antimicrobial resistance. Unfortunately, that was also halted due to migration of staff. But we'd want to comment that as well too, because that's very important in terms of looking at our antibiotic or antimicrobial um, usage, or at least drug usage, and looking at wastage, abuse, things like that, which would be also proved to be barriers to health and wellness. So the most popular one, I just want to touch on this one. So one of the goals of the Ministry of Health again would be ending the AIDS epidemic by 2030. In 2020, they looked at the 1990 plan, and what does that mean? The outcome of this plan would be 90% of persons living with HIV knowing their status, being diagnosed, 90% of those diagnosed receiving antiretroviral treatment, and 90% of those persons treated being virally suppressed, be having low to non-existent, or not non-existent, but negligible viral loads, as well as high CD4 counts, right? So in keeping with that, a few members of staff were sent on training as well, to at least that, not at least to build capacity within the department. And as mentioned before with the previous initiatives, is not for those members of staff to keep the skill sets to themselves, but to be involved in developing and planning and developing new policies. And as we mentioned before, policies would be part of, at least policy keeping or policy making would be part of quality assurance, and by extension, quality control. So moving on, I mean, there's also the IV and TPN chemotherapy certification programs, which members of staff would have been sent on as well. But that would follow the same trend of building the acumen of the total staff to serve the clientele better, and then by extension achieving the goal of 30% reduction in communicable and non-communicable diseases. So that is what systems re-engineering is about. Basically looking at the quality of care, or the quality of the processes that we have within the department, and making changes to that. So moving on to cultural realignment. So cultural realignment looks at the overall attitudes and values of the service providers, which would be us, and looking at the quality of it again, and seeing where do we need to make improvements, or what can we do to change the overall attitude towards work. Maybe a lot of persons don't understand what the overall goal is. So I'll just move straight into what we're doing here. So actually this initiative is part of that too. So I'll just read through some of the things around workshops on effective communication skills for person working in healthcare. So that was discussed just now. Orient new members of staff and reorient older staff with the vision, mission, and core values, with the goal of helping them understand their roles in achieving these outcomes. So I won't go into too much detail of those. This is also available for all members of staff to take a look at. So reinstitute the tactical intervention would be to reinstitute the family structure of the region by creating mutual appreciation and understanding for the services rendered by each department. And this goes back into the core values of of shared ownership or joint ownership. So looking at some of the coordinators, so you have the occupational and educational department, quality would be there too, corporate communications, finance, looking at some of the stakeholders. The overall goal internally and externally would be much better communication with the clients accessing healthcare, get a better perspective of who we are as an organization, as so that we can better fulfill all the goals. Motivate the excellence in delivering quality care and building better harmonious relationships develop that promotes caring, right? And that would go for both internal and external clients and amongst each other as well. Quickly moving along, we move on to the third core strategy, which is health promotion. And this does not apply only to the external clientele, but also to the staff as well, because there's the age-old adage, health is wealth, or a healthy person is a happy person, and healthier you is a happier you. I know Mr. Stevens would have started an internal do some wrongs to lose some pounds initiative where we would have had to submit baseline BMI values and do frequent checkups in terms of exercise, collaborate with the nutrition and dietetics department in terms of developing health plans, or at least diet plans for those who would need it. Looking into the future, one of these plans here, activity booklet for poison information and prevention for school children. That's one of the things on the agenda. Something that we participate in regularly would be lectures to external stakeholders regarding poison information and prevention, which we do for a lot of the oil companies. We have one that should be upcoming with one of the cycle clubs in Trinidad and Tobago in terms of how to manage encounters with poisonous creatures or venomous creatures. How can they avoid interactions with them all around? So as mentioned, we do some wrongs to lose some pounds in-house exercise program weekly. That's another thing on the agenda that was halted due to COVID, unfortunately. With respect to HIV, the HIV initiative, index case testing, robust encouragement for persons to be tested and know their statuses. So in tying back into customer relations, and the dissemination of information, if you are able to communicate with somebody well or better, you're better able to divulge any important and pertinent information to that person. And I wouldn't go through all again. Some of the collaborators that we will be collaborating with these physiotherapists, the wellness coordinators, dietitians, as mentioned before, nursing and the pharmacy team, in-house teams, O&ED for the education part, HR, the quality department, again, to maintain the integrity of the processes, the office or the manager of paraclinical services, things like those. So hopefully by now you all get the idea of how everything kind of ties in to each other. And lastly, the last core strategy would be institutional strengthening. So logically, the human mind is led to think that institutional strengthening would be would be relating to the infrastructure or at least tangible assets, but also intangibles like policies, right? So starting from the top, develop policies and procedures in keeping with international guidelines and best practices. So on this note, the Ministry of Health had embarked on this initiative a few years ago, utilizing a system, a Canadian system called Humentum, to achieve, and one of the goals was to achieve diamond status, which is, I think, the highest level, if I correct me if I'm wrong, in looking at the processes at the hospital and the integrity of those processes, the the standardization of those processes, so multiple members or at least anybody can come in and look at the policies and have an idea of what they are supposed to do in keeping with best practice. So advocate for training programs inclusive of the doctor of pharmacy program, which is still in development. Develop policies and SOPs guiding pharmacists upon assumption of duties. So this is a component. This video is one of those components. Using readiness for treatment form, barriers and adherence form, the electronic medication logbook. So this is one of those initiatives that was completed. At least we would be all familiar with the medication logbook. I mean, well, not for new staff, but at least the persons looking at this video or who are going to look at this video right now. For the ARVs, the HIV and AIDS patients, seeking assistance from monitoring and evaluation officers and the Ministry of Health. Include within our policy codes of conduct with respect to interactions with clients, again, tying back into the customer service components. These guidelines must be aligned with the core values of the ERHA and will be disseminated in the orientation packages of new members of staff. Reorientation of older staff of these codes of conduct when engaging the clientele, etc., etc. So as mentioned previously, the HIV/AIDS collaboration with the University of Washington and the UE, which a couple members of staff would have been going on, and then we have a few other members that we have nominated to go on these courses so that we can all collaborate and improve the SOPs, the standard operating procedures in the department to make it a more streamlined, more standardized to achieve the overall goal of having a highly motivated and developed human resource, which is one of the components of the mission statement. So by now you see how everything kind of ties in to everything, even the simple tasks of dispensing, how that ties into it. I'd like persons to reevaluate the way that you think about these processes and always think about the overall plan. So even in dispensing, the overall plan is to ensure that these patients are fully educated or fully understand why they take any meds, because the end goal is a 30% reduction in the incidence of disease. With the other initiatives in place, we can seek to strengthen or at least to fortify primary care so that a lot of patients do end up at the hospital. So I'll break here, and for now, this would be the end of this video. Continuing in the next video, we would look at an overview of the floor plans of the hospital, as well as touch on a couple quality management or quality assurance tools that were used within the department.